My name is Abdo. I am 40 years old. The story with my knee injury started 3 years back when I was working out at home. It seems that I made the wrong move where I injured my meniscus. So I consulted the doctors there, and the first step was to start with physiotherapy. I've done 10 sessions of physiotherapy, and then it was like normal. And after 1 year, I got my knee hit into the wall of the pool, and it was like a severe pain, and the whole injury got renewed. And at that time, all the doctors that I consulted, they advised that I should go through a knee surgery. I avoided it first, I have to be honest, because of the recovery time. I was afraid that it will stop me from work and doing my normal life. So I said, let me wait a bit, let me give my body a rest, and then we'll decide after a couple of months. And then at that time I moved to Dubai, where I got the appointment for my surgery, but then I said, let me have another opinion. And that was the moment where I met Dr. Taki, who advised me that because of the rest, my knee now is doing well. It's possible not to do the surgery now. And I went again to my normal life. But a couple of months ago, and because I love paddle, I was playing paddle. So I injured myself again in the same knee. And then Dr. Taki said, now it's the time to do it in order not to have a bigger injury for the future.
I'm Dr. Muhyeddine Al Taki. I'm a consultant orthopedic surgeon specialized in sports medicine and arthroscopy, as well as in joint replacement surgery. I've been in practice for the past maybe 18 years, and I have a special interest in minimally invasive surgery, accelerated recovery, as well as surgery without pain. I first saw our patient, Mr. Abdul Karim, in January 2024 after a twisting knee injury. At that point, I examined him and I was suspecting a medial meniscal tear as well as pathology over the lateral aspect of his knee. I gave him a course of treatment which proved to be only slightly helpful, so I requested an MRI of the knee. The MRI came back confirming a medial meniscal tear as well as cartilage injury on the lateral aspect of the knee. Because of the nature of the injury, we decided to go for an arthroscopic procedure to fix his meniscus as well as to repair his cartilage injury in the knee.
And then I went into the surgery on the 30th of January 2024. I told Dr. Taki that I don't want this to stop me from normal life, I have to work. He said that the method that we use, it has zero pain and the quickest recovery and the least invasion possible. And of course I trust Dr. Taki, but I didn't literally took his words. So on the day of the surgery, after I woke up from the anesthesia, I felt like super normal, as if I woke up from sleep. There is like literally zero pain. And I even done my first physiotherapy session after the surgery, and I went walking out from the hospital back home.
The surgery took like 40 minutes. The patient was discharged home the same day, walking on his feet. He had a session of physical therapy the same day, and soon after the surgery, we sent him for regular physical therapy for strengthening and mobilization. The patient came back after 1 week reporting no pain whatsoever. He was very happy with the surgery, and we continued the sessions of rehabilitation over the subsequent 1 month.
I've done almost 12 physiotherapy sessions, intensive one. It was followed as well with exercises recommended by the therapist at home. So I have took care well of my recovery and rehabilitation. And like after 5 weeks, I started to go back to the gym. Started to do slowly but steadily, went back to the treadmill, walking on the treadmill and then increasing the pace, as well as doing some floor exercises, upper body, lower body. Last week, I joined a paddle tournament after almost 3 months of the surgery. I went back and I played paddle, and I was so happy because I played for 2 hours on 2 consecutive days, which of a total of 4 hours, and I felt absolutely normal. There was no pain, I was moving freely, I was running, jumping, doing all the possible things.
To our great surprise, the patient today, 3 months after surgery, won a tournament in paddle tennis. This is great news for us and for Kings because our patients are happy and they are able to go back to full physical activity in no time. At King's, we strive to offer our patients state-of-the-art surgery with accelerated recovery and no pain whatsoever.
So in short, I would like to thank first of all Dr. Taki for his care and for his experience. I felt super comfortable, I felt super confident with his consultancy, with his advice throughout the whole process, from the consultation to the surgery to the recovery. And I would like as well to thank the King's College team and staff for their superb care and the experience that I had in the hospital.